I'm Tori Mason in the CBSN Denver studio. COVID-19 is still top of mind for many of us, especially now as several states, including Colorado, are seeing a rise of cases. That's why every week we get your coronavirus questions answered during a special segment called Q&A with Dr. Dave. Joining me now is CBS 4 medical editor Dr. Dave Hnida. Dr. Dave, the American Academy of Pediatrics issued a policy statement about reopening schools. This comes as several school districts in Colorado release plans for the fall. Dr. Dave, how do Colorado pediatricians feel about this?
Well, it's interesting because the Academy came out and said that in-person learning during the traditional start of school is going to be really important. Get kids back into the classroom. But they did say that it's really important for that decision and how it's done being based on science and health conditions in the community and not for any political reason. So I talked to 5 different pediatricians who are colleagues of mine, and I said, hey, would you send your kid to school right now? And the answer is pretty much down the line where, yeah, I think so. I feel comfortable with the way things are developing. But what I'd really like you to do is to ask me in a month. Because right now things are fairly stable in our state, but we don't know what things are going to be like a month from now. So I think what that translates to us as parents when it comes to having our kids go back to school is when we get closer to school reopenings, ask your pediatrician, get an opinion from he or she, and find out what they think about the reopening of schools. Number 2 is check out what's going on in your particular school district, because even right now, the schools are developing their reopening plans. And if you go online, you can see what their plans are. You need to be very comfortable that the plans are good for your situation, that you feel comfortable with how they are reopening, as well as flexibility built into the plan. What are the conditions in which things would change in terms of how the school is operating, as well as flexibility for you as a parent to have your child be physically present in school or having the child wind up coming back home and doing the teaching from a home environment.
Well, Dr. Dave, last week UC Health actually announced it will be hosting a clinical trial to find a vaccine for the coronavirus. Now, this sounds like promising news. What's your reaction to this?
Pretty good. This is a good trial. They're going to be enrolling patients over the next 2 months. They're looking for 1,000 people who will be followed over the course of a full year. And what makes this a little bit extra special compared to many of the trials that are going on around the country is the fact they're specifically targeting a population. That population is higher risk people, meaning people who work in healthcare, people who are first responders, people who are older, people who are of a situation where they wind up having a chronic health condition. They also want to take a look at the Black and Hispanic populations. And so the study itself is really looking at this group, which actually is expected to be the first group to receive a vaccine when it does become clinically available. Once again, though, it's going to take a year of monitoring to determine whether this vaccine is safe and effective.
And Dr. Dave, positive cases and hospitalizations are on a steady climb here in Colorado. Governor Polis actually spoke a lot last week about gathering in smaller groups and still wearing masks. How important are some of these preventative measures?
Oh, huge. Right now we are seeing an upward trend in terms of case counts. We're seeing an upward trend in hospitalizations, and these are exactly the things that we don't want to see. Fortunately, we're not even close to the level of what's being seen across the Sun Belt, but nonetheless, it is a concern. The other concern is the fact that the average age of the person who is testing positive is just age 32, and that's a drop from age 48 just about 60 days ago. So it's younger and younger people who are winding up developing coronavirus and either being asymptomatic and spreading it or being symptomatic, ill with it and spreading it around. So among other things, the governor did talk about the use of masks, just really hammered down the importance of wearing a mask, as well as limiting the group size of people you may be hanging out with. And that group size is now down to 4, where previously it was higher. And one of the other things that really came out as being very important is actually something a little bit new to this whole thing, and that is ventilation. We're now finding that good ventilation is usually important in terms of lowering the risk of catching coronavirus. We're finding that coronavirus, small particles, can actually live in the air for up to 3 hours, and they can travel distances 20 to 25 feet. So if you're in a small enclosed place with several people, your risk is going to be higher. There's a lot of work that needs to be done, and people need to take a look at this from an individual behavioral standpoint.
We'll keep wearing those masks. Thank you, Dr. Dave, as always, for joining us. And we'll see you back here next Monday at 11 a.m. as we answer more coronavirus questions. To see all of our Q&A with Dr. Dave segments, just visit cbsdenver.com. We'll be right back.